Hello learners, I'm Sakshi Tiwari and I welcome you to our new lesson. Well, I'm sure that there is a time in a year when you have to rush to the hospital, right? But there are times when we are not sure which doctor to refer to. When we have skin issues, which doctor should I see? What about the teeth issue? Okay, I think my eyesight is weak. Now, should I go to a physician or is there any other specialist? Now, I'm sure when we make a call to the hospital's reception, we do get the information that which doctor is there. But it is equally important for us also to be specialized in that. We must at least know the types of doctors who are there to help us and to treat us well, right? So I welcome you to our new lesson where we are going to learn the 50 types of doctors who are there, what they do and what they specialize in. So let's get into the lesson. The first one is general physician. What do? They treat common illnesses like cold, cough, fever, etc. Right? The next one is pediatrician. What do? Well, pediatricians take care of children's health, right? If you have an infant, if you have a children, between the age group of 0 to 5, and if they develop any issue, you must go to a pediatrician. After this, we have cardiologist who treats heart-related issues, heart-related problems, right? Then we have dermatologist. Now, dermatologists are the doctor who specialized in skincare, acne, pimple, maybe any other issue that you develop on your skin, you must refer to dermatologist, right? Then we have neurologist. Neurologists treat brain and nerve issues. If you actually look at these words, the first half word actually automatically tells you that this doctor is this. Cardio refers to heart, neuro refers to nerve, right? Ortho refers to bone. So next one is this one, orthopedic surgeon. Now, orthopedic surgeon focuses on bones and joints, right? Then for women's health, women's sexual health, we have the doctor who is gynecologist, right? Who specializes in women's health. Yes. Then we have ENT specialist. Who are they? E stands for ears, N stands for nose, and T stands for throat. Now, a doctor who treats ear, nose and throat problems is called ENT specialist, right? What about this one? Who is ophthalmologist? Okay. Oh, I can't, I feel that my eyesight is weak. I can't see what's written there. If you've ever faced this, then you must refer to the ophthalmologist, all right? Toothache, who should we go to? Dentist, right? Who focuses on teeth and gums. Then we have urologist who treats urinary tract issues. After which we have endocrinologist. Now, endocrinologists, they actually specialize in hormones and glands related issues. So if you develop one or anyone, then they must refer to this doctor. Then we have psychiatrist. Psychiatrist. Psychiatrists treat mental health issues. If someone is hallucinating, they're getting fits, or they are low, etc., they must refer to this one. After this, we have a surgeon. Who is a surgeon? Surgeon is a doctor who performs operations, right? Then we have oncologist. Oncologists are the doctors who specialize in treating cancers, right? Then we have pulmonologist. Pulmonologists focus on treating the lung diseases. After this, we have rheumatologist. Now, I hope you remember that we talked about, orthopedic doctor who takes care of our, bones, joints. Now, if in case one develops any bone, related disease or issue like arthritis, then we must refer to these doctors who are specialized in it, all right? After this, we have allergist who treats allergies in our bodies, skin allergy or any sort of other allergy. Yes. Then we have gastroenterologist. Now, gastro, right? Again, they treat digestive system issues. Then we have nephrologist. Well, nephrologists focus on kidney related issues. Yes. Then we have this doctor, anesthesiologist. Now, anesthesiologists manage the anesthesia that is to be given to patients during surgeries, and it's a very critical work. In case if a patient gets even a bit of more anesthesia, the patient may go to coma and consequently may lose their life as well. So it's a very critical role, right? After this, we have radiologists who use imaging to diagnose diseases. I hope you must have seen ultrasound sections, right? So what they do is they actually scan you, they see what's happening inside, right? Similarly, pathologists who study diseases through lab tests, right? I'm sure you must have given blood sample or urine sample, stool sample. So pathologists test that and they find out what's wrong in your body. Yes, then we have plastic surgeons who perform cosmetic and reconstructive surgeries. So if somebody has met with an accident, they've got some scar or anything on the face, they may go to them. Additionally, for beautifications these days, right, thinner nose, plumber lips, yes, plastic surgeons help. Next, we have hematologists who specialize in blood related conditions. Then we have otolaryngologists, right, who treat our ear, nose and throat conditions. Again, the advanced one of ENT specialists. Yes, after which we have geriatrician who focus on elderly care, right, like our grandparents, their health. We have chiropractor who treat spine and joint issues. Yes, now can you guess this one? All right, well, they are vascular surgeon. What they do is they actually specialize in blood vessel surgery. So if somebody has cut their nerves or any other thing has gone wrong in blood vessels, these help in that. Next one is sports medical doctor. I'm sure you're able to guess already. They treat sports related injuries. Now we have obstetrician. Now they focus on pregnancy and childbirth, right? What about this one? Okay, they are immunologists, right? As the name already is self-explanatory. They take care of our immune system. They treat our immune system disorders or any issue underlying, right? Now we have infectious disease specialist. Now we have infectious disease specialist. As the name is again self-explanatory, you can see that they treat infections in our body, right? One is a dietitian, right? They provide advice on healthy eating. Yes. This one is a speech therapist. Now, they treat speech related issues, so or maybe communication related issues. So I'm sure you must have seen somebody who stammers, who stutters, right? Tutlana, haklana, right? So they actually take care of these disorders and they help a person get over them. Next one is audiologist. Now they specialize in hearing problem. So if somebody is facing issues in hearing, they actually help us in that. Then we have pharmacologist. Yes, now they study medicines and their effects on our human body. After which we have this one, toxicologist. They specialize in poisons and toxins. Yes. Now we have this one, which is reproductive endocrinologist. Now what they do is that they take care of the reproductive health of a person. Yes, and if somebody develops any issue in that, they actually take care of it and they treat the person well. This one is a geneticist. Now they study genes and heredity in a human body. Next one is emergency medicine doctor. Now I'm sure you must have seen that if there is any emergency situation at home at midnight, somebody is unwell, somebody has met with the accident, then you take the patient straight to the emergency ward, and the doctors who you see there are actually the emergency doctors who actually provide the urgent medical care. All right. Now we have physical therapist. Anybody who is struggling with physical health, in terms of somebody who has been a drug addict, somebody who has gone through a really bad accident, so they help in physical rehabilitation. Yes. Now we have occupational therapists. They help people in performing their daily tasks. Yes, he is a mental health counselor who provides therapy for mental health, right? Like stress, depression, etc. This one is a sleep specialist. Yes, he is a sleep specialist. Yes, there are people who are not able to fall asleep, so these doctors help in that. This one is a pain management specialist who actually focuses on managing the pain, chronic pain. If you're facing any chronic pain in the body, they actually help you to get rid of it quickly. Now we have wound care, who are specialists in treating the wounds. He is a veterinarian. Who is a veterinarian? A doctor who takes care of the animal's health, right? He is the acupuncturist. Now, acupuncturist actually uses needles for, therapy and healing. Yes, they actually, poke or they press the right points in the body for therapy and for healing. And with this, we've come to the end of our lesson. So this was the list of all the doctors who are there. Now, before we close the lesson, let me show you 5 pictures and you have to tell me the name of the specific doctor. The doctor who treats our teeth is, right, dentist. The doctor who treats your ear, nose and throat is ENT Specialist, right? The doctor who treats the skin, issues, well done, Dermatologist. The doctor who treats the joint pains is orthopedic doctor, right? What about the eyes? If you're struggling to see or if you have any other issue in eyes, ophthalmologist, right? What about the last one? If somebody develops a heart-related issue, cardiologist, right? Excellent. Now you have to tell me about this one in the comment section. And to master your English, you can look for these ebooks. Where to find them? Follow me on my Instagram, check my Instagram stories, click on order and you can get these ebooks. I hope the lesson was helpful and I'll see you in the next lesson. Till then, keep learning, keep growing. I'll wait for your answer in the comments. Happy learning.